This is video 17 for chapter 12, Nerves for Anatomy and Physiology. So we have been talking about the synapse, and the synapse is one area where we have a lot of clinical examples with different types of neurotransmitters and neuromodulators that are going to work to either be excitatory or inhibitory depending on where they are. And we also have a lot of mechanisms, a lot of drugs, either legal drugs or illegal drugs, actually work on the synapse. Even pain signals and pain relievers work to block messages. So Novocaine and lidocaine that we use for different minor surgery procedures work by blocking nerve impulses so you cannot perceive any pain. So acetylcholine, here is its structure. It's not a very complex molecule, but you can see that here it gives you some of the sites of release, the effect, if they're excitatory, if they're inhibitory, in the different things, the central nervous system, autonomic nervous system, etc. I am not going to, you're not responsible for these neurotransmitters. These are just different applications of it. So one of the clinical examples is with the disease called Myasthenia gravis. So you can see that right here we have a destruction of the postsynaptic membrane of muscle fibers, which means that we don't have as many gated channels, and that means that the emission of the acetylcholine does not cause an action potential as readily in somebody that has this disease. So it can cause weakness, paralysis, and it's a pretty bad disease. And there's really not a whole lot that they can do for this disease. Other types of, another one is serotonin. You might have heard of this. Here's its structure. And SSRIs are selective serotonin reuptake inhibitors. And Prozac and Zoloft are used to treat depression. So increased serotonin in the synaptic cleft, this causes an increased stimulation of the postsynaptic neuron by serotonin, which helps in relieving depression. So this one actually blocks reuptake of serotonin. So it's in there in that synapse a little bit longer, and it causes more of an effect. It's also used to treat things like OCD, obsessive compulsive disorder. LSD blocks serotonin transporters in specific areas of the brain, and other drugs like ecstasy block serotonin transporters. Dopamine is another neurotransmitter. And cocaine blocks dopamine transporters, which increases dopamine levels, resulting in overstimulation of postsynaptic neurons. That can cause euphoria, but high levels can, over time, can cause psychotic effects. So people will develop psychosis, which means that they might, experience really strong visions on a lot of different things. Parkinson's disease, which is the one where people have involuntary motor shakes. So they that is the destruction of dopamine producing neurons. Tremors, decrease voluntary motor control. So they are working on cures for that. Norepinephrine is another neurotransmitter. So here we have ADHD as a clinical manifestation. So it's treated with drugs that increase the level of excitatory neurotransmitters in the synaptic clefts. So they use SNRIs that block those transporters, which are symporters, and increase the levels of norepinephrine. Amphetamines increase excitatory effects on the central nervous system. They increase levels of norepinephrine and dopamine by blocking the reuptake. So amphetamines can be used to treat ADHD, clinical depression, narcolepsy, which is a disorder in which people fall asleep at any given time. They could be talking to you and then fall asleep. And chronic fatigue syndrome. But an overdose of amphetamines can cause a lot of different symptoms too. Gamma-aminobutyric acid, or GABA, is another neurotransmitter. Barbiturates can have an effect on that, and you can read over this. A lot of them are sedatives or anesthetics, treat epilepsy. Benzodiazepines or benzos are used in anti-anxiety. Glycine, a clinical example of that is with strychnine poisoning, that's rat poisoning. It blocks glycine receptors, which increases excitabilities of certain neurons by preventing their inhibition. It results in powerful muscle contractions, convulsions, and tetanus, or basically the constriction of the diaphragm, and it will not let go, can cause death. So this poisons you by blocking receptors. Glutamate and stroke and exocytotoxicity. We're not really going to go over that. You can read on that one by yourself. We have caffeine, which is affects the adenosine. So adenosine produces drowsiness, which is countered by caffeine, which blocks adenosine receptors and promotes alertness. It also promotes cognition by blocking adenosine's inhibitory effect on glutamate function. Caffeine is the most widely used drug in the world. So it is a drug, just like any other chemical. An overabundance can be toxic. So there have been instances where caffeine overstimulates things and can cause an increase in your heart rate. A lot of caffeine at any given time can have a very bad effect, so you have to be careful. And then we have another couple down here talking about opiates and even erectile dysfunction. So nitric oxide, which is a gas, does have an excitatory effect by being released from nerves, causing vasodilation, or it causes the blood vessels to increase in size. And Viagra, which was originally marketed or thought to be a heart medication, had a very different side effect. And instead of using it as a heart medication, some marketing genius said, oh, we have a cure here for erectile dysfunction, and actually is probably one of the most profitable drugs manufactured, mostly because most insurance plans do not cover it. And I believe that the going price for one pill is anywhere from $40 to $60. So it is a very profitable drug. So you can go through and read some of these substances. We could have a whole course just on neurotransmitters and all their effects. So it's very, very interesting to talk about these neurotransmitters and what they do. So there's a lot of things that we didn't cover that you can read about in here. But again, this content is not going to be covered on a test. I'm not going to require you to know the structure or the effects of these different neurotransmitters and neuromodulators.